Hello, everyone, and welcome to your Medical Assisting Capstone course. My name is Carissa Legg, and I'm really here to help kind of guide you through this 5.5 week course that accompanies your externship that you will be going through for the next 11 weeks. Each week, I try to put up a new video that will help to explain the information from your readings and also discuss your homework assignments. So for Module 1, what we're doing is we're actually looking at 4 chapters. You're looking at Chapter 1 up until the study group advice. Chapter 3, it's really only just a few short pages. And then Chapter 7 up until the terms section, and the same with Chapter 8 up until the terms section. So without further ado, let's go ahead and jump in and get started. So for Chapter 1, this chapter is really discussing the certification process and really preparing for that. So at this point, you should be, or hopefully you are, preparing to sit for your certification exam. This can be a time of great excitement, but also great chaos. I remember being in that seat many moons ago, so I can only imagine how you all are feeling. So, with that being said, this chapter really kind of helps you to better find a balance to help you kind of prep for that exam. It also is important for you to understand that holding a certification is very important, and it's important for quite a few reasons. So, it's important to help really demonstrate to employers or potential employers that you have a standardized body of knowledge. It helps to expand your responsibilities that you can have. And it also helps with healthcare because it's always changing. And the more prepared you are to deal with those changes, the better off you will be. And being that the Center for Medicare and Medicaid Services now has a system called Meaningful Use, it requires that medical assistants are certified. So now with that, it's important to know that there are 2 major organizations or exams that you can sit for. The first one is going to be your Certified Medical Assistant, or your CMA, that is given by the AAMA, or the American Association of Medical Assistants. This is where graduates from an MA program that is accredited through CAHEP or ABHES can sit for this examination. Students who complete one of these programs may take the exam 30 days prior to completing formal training. The second is going to be a registered medical assistant, or an RMA, through AMT, which is the American Medical Technologists. Again, graduates have to be from an ABHES or CAHEP program to sit for the examination. But with this, it isn't the only exam that this service offers. They also do other certifications and registrations. The big thing that I will say here is that being a registered medical assistant, not that there's anything wrong with it, it is a little bit of a detriment just because you aren't able to do as many things as a certified medical assistant. And not much more continuation of education is available for you guys. So kind of keep that in mind. Everyone here at Rasmussen will be certified, so always a good plus there. So now after you've kind of completed this examination, you have to learn how to maintain your certification. And for each of these, it's a little bit different. So for the CMA, you have to have 60 hours of continuing education units, or CEUs, in a 5-year span, or 60 months. Where a registered medical assistant will need to pay a registration fee every year, and you have to have 20 CEUs every 3 years. So a little bit different. Certification, again, does look a little bit better than a registration, but either one is acceptable. But at this point in the chapter, it's really kind of showing you kind of where you can get those CEUs from. A lot of them do come from attending seminars or conferences, but there's a lot of online programs that you can do that will actually give you CEUs as well. Typically 1 hour of work is 1 CEU, depending on the course that you take. So next thing that the chapter kind of goes in and talks about is really learning how to kind of study for the examination and giving you some key pointers. So one of the nice things about this chapter is it gives you information from those who have already taken the examination, which is always awesome and always very helpful. It gives you things to look at and gives you tips on what you should do. For example, it talks about joining a study group. So one of the things that I will always say is when you're taking or you're thinking about joining a study group, look at the pros and cons of it. For example, one of the biggest pros is that, your study times are designated. They're already designed, and you guys have already come together on that. Your work is shared, so you guys can kind of learn off of one another. And one person's weak area could be somebody else's strong area, so that will really help. But some of the cons are you're dealing with a lot of different personalities, so sometimes that's a little bit hard to find a time and a date that works for everybody. It's also hard to know if everyone's participating equally, as well as knowing that not everyone learns and studies at the same pace, so that can hold people back. So kind of think about that as you're prepping to put together a study group. Moving on, I'm going to talk about chapter 3, which is really creating your own study plan. Now, this is one of your homework assignments this week, and I'm going to talk about that at the end of the video, but I really suggest kind of reading through this unit, reading through this couple of pages in your chapters to really get a good grasp on how this can be helpful. One of the common characteristics among those who pass the certification exam is that they had a study plan. It's kind of a roadmap for where you're going and how you're going to get there. It's dedication and commitment, and those are essential into passing this examination. So when you're trying to create a study plan, a couple of things to keep in mind are determine how many hours per week you have to really designate or devote to studying. And be realistic. Use a calendar and assign your study hours each week and plug in a specific subject that you want to study in that time and know that you're only going to focus on that piece. And adjust it because truthfully, life changes. It's never going to be the same, so neither should your study plan. Chapter 7 is kind of talking about discussing human behavior and human communications. So communication is the process of forming and transmitting a message or encoding a message to a receiver who interprets that message or decodes it, and in most cases transmits a message back to the original sender. It's kind of how the repeat cycle works. It's how communication works. Now, in the medical field, the ability to communicate is essential for success. Everything from calling in a prescription to be refilled to documenting in a patient's chart requires you to have some form of communication. There are stages that we talk about. Generally, they're divided into specific age groups. And when you're communicating with people, you need to be able to understand the various ages because somebody at an infant or a toddler age may not understand at an adult age. So you have to learn to adjust your communication based upon who you're speaking with. Types of communication that we have there's 5 different types. There's formal, informal, verbal, written, and nonverbal. Your book does a great job of kind of breaking those down, but there's also things that we've been talking about this for several quarters now. So types of communication and barriers to communication really should not be that different for you and shouldn't be that difficult to understand at this point. We also want to look at psychological defense mechanisms So pretty much how people handle certain situations can be a defense mechanism, a way to kind of save themselves the pain that we're about to give them. And here I've listed just a few of the mechanisms that we do have, but again, your book does break down that discussion very well. Maslow's hierarchy of needs is something that we talked about in your Clinical Skills 2 course, and if you've just come from that, it really shouldn't be anything that's too unfamiliar to you. Essentially what that is it's just discussing that people have special needs, and they move through various levels of achieving a satisfaction in their life. And the last thing this chapter talks about is the 5 stages of death and dying, and kind of how you will handle those, how you'll be professional with those, and how you'll move through them and help your patients and family members move through them. Last chapter we have is chapter 8, which is talking about patient educations. So whenever you're dealing with a patient education, it's really important that you understand the purpose. And the main purpose is really to promote and maintain a healthy lifestyle. It's helping that patient understand that they've been given something that they need to learn in order to better their own health. Patient education isn't just talking about new medications that they have. It could be anything from, learning how to do self-examinations, learning how to do different diets, learning how to do pre and post-diagnostic instructions or surgery instructions. Patient education is so vast. So kind of think about that as you're moving through this. Now, whenever you're putting together a patient education, there are several things that you really need to look at and take into consideration. For example, the domains of learning. So how does your person or your patient actually learn? Do they learn from comprehension? Do they learn from their attitudes and their values and the way they were raised? Do they learn from actually any mental or physical disabilities? Then you have to think about the actual factors of this. How old are they? Are they motivated? Do they have any developmental delays? Do they have any language or religious beliefs that will stop them from this? So keep those in mind also. And finally, how do they learn? Are they visual? Are they auditory? Are they tactile? Do they have to touch it and feel it to see it, to do it? And then the last thing I put on here are just some kind of like tips and tricks for teaching and different modalities. The modalities are the different tools that we can use, so you can see those there on the right side of your screen, and the left side will show you some of the really important things that are needed in patient education. Now, when putting together a patient education plan, a couple of things that you do have to look at. Again, identify the topic and the purpose. Make a plan, develop that plan, implement that plan, and know that you're going to have to change that plan for every single patient. No one patient is going to be exactly the same. All right, so last thing I want to kind of talk quickly about is your homework for this week. So homework there is in the purple, and one of the first things that you have is your written assignment. So creating that CMA study examination for yourself, kind of your study plan. That one, we actually give you the template. I actually want to see you put together your study guide. I want to see how you're really planning to study for this exam. Your course project that you have is looking at patient education and talking about what they need to know. What you'll need to do is you will select and research a disease of your choice and then design a patient education pamphlet that you might share with your patient about their disease. So you're selecting a disease that you find interesting and you want to know more about. You're selecting a suitable word template that is a pamphlet. And then you're going to use 3 credible sources to get your information. You're going to explain the disease. And then there are some other things that you need to include with that. Okay. And the last thing is that you do have a live classroom that you need to watch. It is a CMA study review, okay? There is a link in your assignment to that website that you can go to and the meeting. So please make sure that you're watching that and completing the worksheet. All work is due Sunday, October 8th by midnight. Bye, guys.